Welcome to Medicare.
Para español, marque 8.
In a few words, briefly tell me the reason for your call today.
Medicare Social Security eligibility Part C and D questions.
You have a question about Part D coverage. Is that right?
Right.
All right. I'll need your Medicare number from your red, white, and blue Medicare card. Do you have that handy?
Yes.
Great. Please tell me your Medicare number.
3P67P82 CH71.
3P67P82 CH71. Is that right?
Yes.
Next, please tell me your date of birth. For example, April 9th, 1952.
May 22nd, 1997.
May 22nd, 1997. Is that right?
Right. Correct. Yes.
Welcome back. Medicare offers prescription drug coverage to everyone who has Part A, Part B, or both. During a valid enrollment period, you can get this coverage by joining a Medicare prescription drug plan. To shop and compare plans, you can visit medicare.gov. If you have a phone that accepts text messages, I can text you a link. Standard messaging and data rates may apply. You can say, repeat that, text me a link, or for more information, say representative. You can also say,
Just a moment while I transfer you to a representative who can help. This call may be monitored or recorded for quality and training purposes. After speaking with a representative, would you be willing to take part in a survey regarding your customer service experience?
Yes.
Say yes. Thank you. After speaking with a representative, please remain on the line for the survey.
Thank you for contacting Medicare. My name is Angelica Perez. To better assist you, may I have your name or the name of the person that you're calling for?
Calling on behalf of myself, I'm Jeffrey Thomas Bodin, Bodin, date of birth 05/22/97.
Okay, and what is your mailing address?
406 Parkview Boulevard, Mandeville, Louisiana 70471.
Okay, how can I assist you?
I got off the phone with Medicaid for my state of Louisiana earlier today, and apparently my Medicaid in full has ended on the 28th of February 2026, due to that being some sort of a 3-month review period for myself. However, Social Security has only sent me things that indicated that I was supposed to be covered under the state for prescriptions and things, and that I'm still supposed to have my same Medicaid coverage and my same insurance plan, and that Medicare Part A and B covers things, and then it falls back to the state's Medicaid, which is my managed care organization, which is at Better Health of Louisiana, and that they're supposed to be continuing to handle my things for me because I'm disabled, I'm on Social Security. Social Security granted me Medicare, but it doesn't go into effect until May the 1st, and that's only for Part A and Part B. It explicitly specified that I don't get, and I'm not supposed to get, like I'm not supposed to purchase, I'm not supposed to attempt to purchase, I'm not supposed to be buying my own drugs, things like that, for like C and D, because I'm already covered under like the Medicaid itself still for that. But the state, when I was trying to explain that kind of to them, they really should have known offhand what I was talking about. They just kept saying that Social Security was somehow the one who canceled Medicaid for me. So I don't really think I'm getting through to my state properly, and I've already gone through the whole like appeal thing. I already had Medicaid for my state with a Medicaid analyst approve me that my income was within the limits for the state, and that I was supposed to be on Medicaid, and that was in December, and I was, according to her, I was supposed to no longer be evaluated until another 12 months had passed, due to the dangers of continuously trying to evaluate me, and me getting killed because of my cancer. So it just didn't, it really doesn't seem like I should have any like lapse in coverage, drops in coverage, or have anyone like not immediately knowing how to fix this. And because even the Medicaid representative that I spoke to tonight, she confirmed that my state had not sent me anything in the mail, had not mailed me anything about my coverage ending at all. Neither had my insurance company. And I didn't find out about the insurance company no longer somehow covering me, or Medicaid being canceled, until the 18th of February 2026, when I called to try to schedule transportation. I think that it's called NEMT or something, or whatever that program is for the Medicaid transit that I always get. Because I'm disabled, I can't drive. So Social Security has me do that. And that's when I was informed only by them that they had no authorization to schedule into the future any trips at all. Otherwise, I wouldn't have known about this, period. Even confirmed, by Medicaid tonight, that the state was not communicating anything with me at all, like they did last year when they sent me paperwork and things to go through the process with them, to where it was very clear from that paperwork and things I was supposed to be covered by Medicaid, and that I just had to go through the motions with them, and did. And then it looked, as far as on my end, that I had succeeded, and that I was going to be covered going forward, and that there was only going to be a change with Medicare with y'all, of which I'm still not sure what it is, on May the 1st of 2026, whenever somehow some other coverage comes into effect. But since, the most pressing matter to me, since I have the same access to the same physicians on Medicare and Medicaid, they're the same as far as I'm concerned. They always have been for me. I'm that type of patient with those types of terminal conditions that there's no difference. The only real danger is losing prescription coverage and losing my insurance company specifically, due to the lengthy process they went through to ensure a court-mandated forced authorization of my prescriptions. That not having that means I could get killed, and dropping and switching coverage and different providers and things was always something I wasn't supposed to be allowed to do, due to that fact alone, because of how dangerous that is. It took about 4 years, with about 2 year itself prior authorization processes, with Aetna paying for a nurse practitioner both times, and the judge working with me both times, and me clearly being, the United States in terms of who's represented, to where it was all being put in place so that it never would happen again. But if I'm on a different insurance company, or I'm not on Aetna any longer due to someone, for some reason, believing that I, one, would have the resources to get insurance or even have any copays, because I couldn't afford copays. Even a $20 copay for a prescription, that could be the life or death for me, as it was before. And having it fully, either I don't get the medicine or it's covered, was what they were using the judge to do. And it was a very touch and go circumstance that I may not have. I don't think I have the living situation or the ability to do that again in the future, especially not with zero insurance and overall, because the judge's ruling was for Aetna to cover it in like perpetuity. I don't know what to do if it's not the type of insurance plan that Medicaid is paying for, that has all of these nurses, these registered or these nurse practitioners. Sorry, it was an RN, then it was a nurse practitioner, who are assigned directly to just handle that one very intensive court process for the one Social Security entitlee with the fully favorable permanent disability status under the Social Security Administration, the United States of America, because Social Security can't re-review me as potentially being less disabled. They don't allow the state to do so either, because they ruled initially at an unappealable appellate. That was the whole point. And I was expedited through that. I jumped ahead of most everybody else whenever it was supposed to be a 10-year process for most people who may be able to work or kind of extend things so that they can get normal disability through insurance. They skipped straight through for me, and it took 2 years because they knew that every day counted and that I could have died. And it's such a very strong case that it's just not an issue. And through that whole time, I had Medicaid. So I don't really understand what I'm supposed to do. It just doesn't seem like there's any information that would suggest, even when I was looking through the Louisiana's documentation for their own internal like codes and things, it had nothing but exclusions for what seemed like people like myself. Like it would be like, refer to this document or refer to this thing, and then it would show exclude all Social Security income entirely, and then another part would say the same thing. And I just don't understand how, if, as the representative tonight said, and I believe that she was telling the truth, she said that last week they made the final decision after 3 months apparently of reviewing me entirely for forever being eligible for Medicaid again in the future, like going forward. I don't understand how they could have done that and reviewed me at all. And whenever just clicking down the list of the under their index of the documents like blind, I saw nothing but things that excluded myself. And I know she wasn't the one to make that decision or that review. That's not her, their department, their job or anything. But she did say they did that last week. And I don't know how they could have done that at all without doing something either wrong or it just being some sort of an entire mistake or some sort of error. Especially because even she confirmed verbally that they had not sent me anything. And the last thing that she said she could see that they sent was, I believe, in November of 2025, and that was after I had explained the different documents that I had received from the state after November 2025. like in December, like late or like early December, which helped me get into contact, I guess, with the Medicaid analyst and things like that. That if they can't even see that they sent me things and they did in December, then I don't really I just don't understand what's going on.
Okay, so you contacted Medicare. What exactly do you need us to help you with?
I don't know. I used the general number, and I guess if you're saying that, then, well, I don't know what I need help with. So I guess from your experience with helping others who are losing Medicaid, and it seems like they shouldn't have lost Medicaid, what do you suggest I do?
So because you are receiving disability benefits, you are now eligible for Medicare as your primary insurer. If you still qualify for Medicaid, it would be your supplemental to Medicare.
Yes, that's what the information y'all sent me about from Medicare.gov, like from Medicare, like Social Security packet for 2025, whatever, the little booklet. That's what it said in there. It said that it was supplemental, yes, and that I qualified. It was like highlighted and stuff or whatever, and it was like on its own that this is you type of a thing.
Let's see, one moment. So if you find out that you're still eligible for Medicaid, you do not necessarily have to have Medicare Part B. You could just keep the Part A. And continue to receive the Medicaid. But if your state says that you have to have Medicare, then yes, you would have to keep it and have Medicaid as your supplemental.
That's what the information I was sent to know by Social Security said, yes.
Mm-hmm.
I don't know what that exactly means. I don't know the difference between the two, but it doesn't seem like it applies to me. It just seems like I don't get a choice. And I'm fine with that. As long as I don't somehow have zero prescription coverage at all, because that obviously would be incorrect in some regard. That just doesn't seem like it would serve the purpose of being covered by Medicare or adhere to what the judge's, fully favorable status would for Social Security. To me, it just seems like that's backwards.
Okay, do you have any other questions for me?
Was there anything you guys can do? Like,
I'm not sure what you're asking us to do. I'm sorry. You've never really asked anything. You kind of just explained a lot of things. Some were relevant to Medicare, some weren't.
Somewhere in there it would have indicated what would push me in the right direction. Is there anywhere on your website that you would instruct me to maybe look at or something? I'm very uneducated about Medicare. It in general, since I've never been on it, and Medicaid has only seemed like it just an insurance, a way to get onto within a contracted insurance company. So, and I have yet to receive any information on choosing during an open enrollment period or something like that a Medicare insurance company. I just have only received information that I have Medicare and the date it starts, and that's it.
So Medicare is an insurance, but if you want like a private insurer, once you're actually are enrolled into Medicare, because I do see that it starts in May, you would have 3 months after enrollment, or the effective date, to decide whether you want a Medicare Advantage plan or straight Medicare as your insurer.
If I'm not able to get Part C and D or whatever the prescription one is, what do I do to get my state to give me that through them, I guess.
Well, they will, if you continue to qualify for the program with Medicaid, you will automatically be enrolled into a drug plan.
The state is telling me today that I somehow all of a sudden don't qualify for Medicaid. What do I do now that that's the case? Even if that's incorrect, what do I do? Because the automatic, if we're relying on the state, which seems to have made a mistake, for that automatic enrollment to happen, is there any way for me to contact or force an enrollment so that it can then be reviewed at a later date? Because it's waiting for the state to decide on something that the feds have already decided I clearly get, is where it seems to be the problem. Or if there's some way or someone I could be transferred to within Medicare at the federal level to initiate some sort of an action to provide some sort of a notice that would then rule that I do in fact receive the supplemental Medicaid as listed here and here, so says the United States in some way, and then I could just provide that as a document to my state or something, and because I have not found that through Social Security's website under the documentation they can provide me, nor what I requested verbally on the phone a few weeks ago. They did tell me to try to call y'all. So is there some way I can request a form, a document, or like a statement that would show what you can see on your end of what I get through Medicare?
Okay, so first of all, you did ask to show that if you had Medicaid or not. Mm-hmm. So you're going to receive your information from Medicare showing that you have Medicare. You will receive the welcome pack and you will receive your card.
I did receive that, yes, but I'm asking about like a statement of benefits, like with Social Security or something. My statement of benefits with Social Security actually on the second page shows I have Medicare, but it only shows my Medicare number. It doesn't, and I did submit that to the state, but that doesn't seem to have changed anything about the state's decision that they told me about today, about me somehow not getting Medicaid. Is there anything that y'all have that has more information that's not just the welcome packet, or that white card with that has the little punch parts on it or something? Because I have that. That's not necessarily what I'm talking about.
Okay, so why do you want to show proof to Medicaid? What are you trying to accomplish
here? The state has an appeal
here?
process, and they asked me for documentation to upload when I started the appeal, and I didn't have anything to upload, but I submitted the appeal anyway. But there was a section that said, click here to upload a PDF of documents that show why we're wrong, basically. And there's a website that you do it for the state. It's the state's Department of Administrative Law, and they handle the state's Medicaid stuff through that. I don't know if in other states it's an automatic thing, but in the state of Louisiana it's like a back and forth thing. So that's why I want the form on hand, or some way to generate it or have it mailed to me so that I can then give it to them. Because I just don't believe they have any way to access anything like that, if it exists.
So Medicaid is based on income. They're asking proof of income. They made their decision based on your income. There was no other reason why they made their decision. So if you feel that they're incorrect with the enrollment, then you are appealing. They're going to want proof of that income that you are receiving from Social Security Administration. And a benefit verification letter from Social Security Administration would be proof. It will show your income. And if their indications on Medicaid side show that it matches what you receive in Social Security benefits, then that was based on their decision on the income. If the income matches what you reported based on what Social Security has, then there's a possibility that the appeal won't be in your consideration.
Yeah, and I don't really... I understand that. I'm at kind of the level to where I just don't care. I'll just do it anyway and force it through, because the same thing happened with me with them denying like drug coverage for me for necessary drugs. Same thing happened with chemotherapy. It's always ended up being the same thing. The feds already ruled that I have to be covered. I'm not supposed to not have these things. I'm used to being, informed of the fact that, yes, the state usually could say no, and then immediately I just go to the next step in the chain, and then a judge always ends up ruling in my favor. After that, it's like a process to go through. I understand that that's just how it works. Might be a bit uncommon for that to always be the case, but I have never one single time not had the United States intentionally do that. It's always how it works. There's never since there's no way for me to possibly pay myself to somehow be able-bodied. That was why the judge found the decision they did at the federal level for the Social Security Administration, and somehow that just overrides everything. But it usually has to be taken to the highest level at my state, which is, I guess, basically where I am right now. And then they go through the whole discovery process and stuff like that. It's just, in the past, I've had my insurance company doing that for me with Medicaid. I've never had to somehow, I guess, appeal the fact that I'm supposed to have Medicaid in the first place. That's just kind of new. But I've also never qualified for Medicare before. Is there like an account portal kind of a thing that I'm supposed to have access to, like the Social Security Administration has? I know that my coverage for Medicare doesn't start yet, but I received no information on like how to sign up somewhere, how to like call and set up an appointment or anything like that. And I haven't found any way to do it like online either. I've only found like information on plans and stuff, but not almost everything doesn't seem to apply to me. It's always about it's always like oriented towards individuals who are elderly who can pay for a premium or something like that, not someone like myself who seems to be disqualified from even doing that overall. Unless you'll have some sort of a plan you can put me on for drug coverage that effectively does the same thing that Medicaid would have done in my state with a different insurance company or something. I just can't seem to find it myself.
You would go to Medicare.gov, but you can't make appointments. There's no appointments with Medicare. But on Medicare.gov, you would not be able to find the benefit verification letter. You would have to see that on your Social Security portal.
I have that. I'm trying to find out like what I'm supposed to actually try to sign myself up for. If I go to health and drug plans on your site menu, it has Medicare Advantage and other health plans, Medicare supplemental insurance, and how Medicare works with other coverage. I don't have any other coverage. I don't have a pension or anything like that. I don't believe that Medicare Medigap applies to me because I don't have, unless I have original Medicare, which I don't know if that's what I count as or not. And I don't know if, and the first one is kind of not very descriptive. And then the last one is drug coverage Part D, which says helps pay for, and it's optional. and it does very much seems like I'm not supposed to have an optional drug coverage to select at all. Since the drug costs of some of my prescriptions has been over $1,000 per bottle necessary per month, and that's just one. We're talking like maybe 20 prescriptions or something. It would be, even just paying co-pays for them would eclipse my actual monthly income easily. It's just absolutely guaranteed. That's why I've never been allowed to do that. I've never told how much the prescription costs in general. I only know that $900 or so amount to tell you, due to that drug being reviewed and the state calling me about it last year. Outside of that, I'm not usually like privy to that actual information. I've even tried to request it in the past and been told no. So, I don't know, out of these four options, I don't understand which. This doesn't look like the anything else I've dealt with so far with Medicaid, where you select a plan and stuff like that, and you have things immediately available to click on. These just have information about a program, not actual.
So in order to get like a comparison on drug costs with different plans, you would have to create an account. So you would enter your drug, the type of drugs you have, and then once that's entered in the system, you would be able to check out the different plans that are available to you and which prescriptions they do cover and the cost.
Is the plan for just Medicare.gov, or is this a plan for like Social Security's website to where it actually connects to the system itself instead of just, like just a save your information type of a thing? So that I could try to go directly to where I can connect Social Security to it, because I like the healthcare marketplace.
I'm not sure I understood your question.
Okay, maybe
it doesn't
wasn't
connect.
able to make
So
one
these
of
are two
before.
different.
All right.
They're not connected. They're two separate.
They're two separate things.
Sites. Mm-hmm.
Is there a period of the year that I'm cut off from applying or being put on like Part D plans?
So after your effective date, you would have 3 months to enroll into a plan. And then once you are enrolled into a plan, there are open enrollments periods to change, disenroll, join a different plan. Would be during open enrollment period, which is from October 15th through December 7th. And then there's another open enrollment that we are currently in right now, which ends March 31st. It's for people who are already enrolled into Medicare, and this gives them the option to just switch plans or disenroll. So you would have this open enrollment, your own initial open enrollment. And then again, like I said, in October, you would be able to decide if the plan isn't working for you, you could always switch to a different plan.
Would any like appeals or judgments made to cover medications carry between plans, or would it be plan specific? Like for prior authorizations, because I read something about that on y'all's site, but it wasn't clear.
I'm not sure what you're asking. I'm sorry.
So to be covered at all for a lot of medications for me, you're probably going to require another prior authorization and an appeals process.
Mm-hmm.
If I find out the plan isn't working for me, et cetera, will that all have to be redone again with a different company, or will it just be like done in general?
So if there are medications that need prior authorization and from the provider, if you were to change plans, that exact plan would also need a prior authorization. It doesn't it doesn't roll over.
Okay. Why didn't it allow me to sign in? I'm trying to sign in, and I made the account, I entered my number, entered my cell phone number, and oh, okay, I just must have entered it wrong. I mean, I guess I only received my card like a few weeks ago, so I don't know, last week of January, so I guess yeah, it doesn't say, it does say original Medicare, okay. I thought I wasn't supposed to have a deductible. Oh, is this a yearly deductible?
Yes.
Okay, so my yearly deductible is $283. And that does not include coverage for prescriptions. That is only hospital medical insurance, so doctors and things.
Yes, that would be for the deductible for the doctors. All right. Is there any other questions I could assist you with?
Yes. I have figured out where the health or drug plan section is. It says that it has listed none under extra help for the app program. There's something called the prescription payment plan. What is that?
That is if, say, your out-of-pocket costs are really high, the prescription plan will, like, I should say, like, send them out monthly instead of paying one time a high amount.
Oh, okay, so like a pay in 12 months type of a thing. Okay, that sounds good. Is
Yes.
there a way for me to enroll in that right now?
You actually would have to have a plan first to enroll.
Oh, okay. Are you able to put me onto a plan?
Let me see. Yes. Yes, we will, because it is, let's see, hold on, 3, 4, 5. I think so. I'm not sure. Usually it's 3 months before the effective date, but we can try. It's getting closer to the date anyways. 4 or 5, yeah, it is 3 months. 4 or 5, yeah. But it won't be effective until May.
Well, okay, let's just try. Because I mean, it's pretty dangerous not having prescriptions for 2 months, but, and I don't know what I'm supposed to be doing about my doctor's appointments, and, you know, I just had surgery, like, last week, so I don't know, about that, but, I guess I'll do my best to get through the next 2 months until May. So, yeah, let's just get the plan set up.
Okay. Wait a minute. Let me just take a look at some information. Do you mind if I place you on a brief hold?
Yeah, sure.
Thank you. Okay, sorry about that. Wait. So because your effective date don't start until May, we here at Medicare will not be able to enroll you until anytime between April and August.
What about the Medigap thing?
Usually Medigaps are for 65 and older, but you may be eligible for you may be eligible for Medigap. Let me look up the information really quick.
Okay, because it is like a little bubble that I can click on here. So I was just reading a little information pop up that popped up.
Let's see. And just so you know, they do have premiums as well. So you will also be paying, if you don't get Medicaid, you would also be paying for your premium for Medicare and your premium for the Medigap. And they could run anywhere from hundreds to 500s premium, depending on the type of coverage you need.
Yeah, I can't afford that, but I'll still sign up for it anyway. I'll figure out later on type of a deal.
So these Medicaps are for if you are under 65. They're only for, let's see, for people who have ESRD. Let me take a look to see if it would. You did mention you collect disability. Let me see if that would apply for you. Yes, so it's disability and ESRD. Okay, so it's not. You don't have to have both. Let's see. So as long as one is available in your state, you would be able to purchase one.
Does this mean Medigap doesn't cover prescription drugs?
Yes, that's what it means. Medigap is to cover the 20% of, most likely the 20% of what Medicare doesn't pay, because Medicare pays 80% of any services.
The thing I got in the mail said that I have $0 copays and premiums through Part A and B.
Right now, I don't see that information has been updated with Medicare. I just see that it was as of February. But your Medicare doesn't start until May, so I don't know if the state is still processing the information to Medicare to show that you will have coverage in May.
Oh, so it probably only said that because of that. Okay, well, I guess I'll try to select the option for Medicare drug plan. Do you want to see your drug? Yes, I'll see that. Drug cost plans. I don't want to see I don't want to actually enter everything. Is there a way for you to tell me up front what is the highest, like, enrolled into prescription drug plan for Medicare? Like, for my zip code or something? Lowest. Yeah, it doesn't have that by sorting for me, but if, like, you just have a way to sort it on your end, that would at least narrow some things down by popularity, maybe.
So did you enter your zip code?
Yes. It sorted it automatically for me. Actually, I don't even think I had to do that. It says plans in St. Tammany, Louisiana, and prescription drug plans. Filter by insurance carriers. I don't have anything selected there, and I don't have star ratings selected. And sort plans by lowest drug plus premium cost. I think it would be more helpful just to know, like, the how many people are possibly enrolled or something like that. The star ratings are probably not that relevant to me. And I kind of expect that it's one of the many different like assistance for Social Security and disability and things like that for income for federal poverty level that I was seeing on my state's website for Medicaid will, and from the stuff in the mail that I'm supposed to have supplemental with the state, will probably end up kicking in or somehow will be in effect to assist with this maybe once I get it. So I'm not really looking at the cost of them, like the deductible, the drug and premium cost or anything like that. I'm more looking on there has to, whichever one somehow has the largest amount of people probably includes me too, because they'd probably be the ones who would best be able to handle someone with such high needs if I'm not getting the state to do it through Medicaid anymore.
So no, we don't have how many people are enrolled. We don't see that. We don't. I don't. Yeah.
Yeah, my state usually shows that as an option when you're looking for things with insurance. In this state, we have like an office that does that. So it's usually like one of the things that pops up. That's why I ask. But it doesn't look like it. These look like different things than a normal like healthcare insurance plan. They look like they're just, I guess, just for drugs, but what is the star rating actually? What does that actually mean? Like just the Medicaid recipients or Medicare members rating like on surveys or something like that?
So they're rated by customer service. There's other reasons why how they're rated. Customer service and I guess prescription cost, coverage, and if it was a plan, another plan like an Advantage plan, it was also coverage based on benefits, benefits coverage, customer service. That's how they're rated. Easy to they say cost as well. So they're from beneficiaries.
Do I have access to more than just the plans in my zip code?
No, it would only be for your zip code.
Okay. There are no like other listings than just the ones on this website for Medicare.gov, right? Like now that I've signed in and everything.
Yes, under your zip code, correct.
If I enter the prescription drugs I want covered, will that change anything, or is it this, or it's just the same? Because it really is only showing me 10 options.
So you would be, when you enter your medications, the system will give you the cost of every medication, which each different plan. So you're able to compare 3 different plans at the same time.
Okay, maybe I'll just put one medication. I expect it to just say it's not covered, but I believe that I'm allowed to appeal stuff like that anyway, so Wait, sorry, 1 second. Let's add the drug that went through the court process for. Maybe this will change it. Yeah, it would be more than my income to receive one prescription that I was ordered by a judge to take. It is there do the part Medicare Part D are there yearly caps on the amount I pay for drugs?
Yes, they have a yearly cap of $2,100.
That's more than a month's income for me. But I guess, and on top of that, I still have to pay for a premium and a deductible for the year.
Some plans there is a premium, yes, and some plans have require the full deductible, and some plans, usually it's the plans that have a premium. There's some that are a lower deductible, but yes, all plans will have a deductible.
Looks like every plan has the same deductible. Oh, and this one has $100 a month on top of that premium. And you pay the premium every month, irregardless of you hitting your insurance plan deductible, right?
Yes.
Oh, this one's $100 a month, but it has a $0 drug deductible. Wait, what? I do not quite understand. Okay, the monthly premium, the amount you pay each year for, I pay $0 before it starts covering. So I guess it will start covering immediately. But it also says that I have to pay for the drugs too.
Yes. So before you reach your deductible, you would pay up to 25% of your covered prescription drug costs.
The Humana
that would be
Premier RX
after me.
plan says it has a $0 deductible, though.
Yeah, that's if you have one.
So it has to be above
So
zero for it for me to hit that, and then they cover it. They're just saying they don't cover this, I guess. But it doesn't look that way necessarily. It looks like they cover the medication. I'm not quite sure. It doesn't say. It says it doesn't require prior authorization. What?
Did you click the drug coverage details?
Yes, and the quantity limits are within the actual amount of that I'm currently prescribed, so that's good. So it wouldn't like outright deny me for next month if I got the plan today or something, but it. And I added a mail order pharmacy, and I also added the pharmacy I go to, and it is just. It says I would somehow pay $70.68 a month after my deductible. And some months, yeah. Wait, but the mail order pharmacy which doesn't describe anything else about that, has no every other. It's like pay for $150, then every it's gonna give me a 90-day supply. I've never received a 90-day supply. I don't even know if you can receive a 90-day supply of this medication. If controlled substances are even allowed to have that, but that would be $50 a month for that, I guess, if that's correct. Oh, this is the Medicare prescription payment plan thing. Okay. Showing, breaking it, the whole cost. Oh, that's why I was confusing it. Down for the year. Okay. So you're not able to sign me up for any Part D plans right now.
Right, not right now.
And Medicare Advantage is does that replace my A and B and also give me Part D?
It doesn't replace it. It's actually a combination of Medicare and the Advantage plan.
What's the Advantage plan?
Any of the Advantage plans, like you just mentioned, United Healthcare. They would cover additional benefits that Medicare doesn't cover.
The
So Medicare doesn't
RX
cover.
plan?
No, you were asking me if an Advantage plan replaces Medicare.
Part C, I guess, yes.
Okay, so it doesn't replace Medicare. It's just, I said it's a combination of the Advantage plans could be a combination of A, B, and C, and then you could also get the prescription drug coverage from the Advantage plan as well. But just keep
And
in
I'm not
mind
able
with an
to
Advantage.
sign up for that either.
No. But just keep in mind that Medicare usually don't pay a co-payment for services until you reach your So Medicare, you pay a co-pay for any services until you reach your deductible. With an Advantage plan, you will always have to pay a co-payment, regardless if you met your deductible with Medicare. Well, it wouldn't actually. If you go into an Advantage plan, the Medicare Part B deductible wouldn't apply. So you're still paying under an Advantage plan. You're still going to pay the 20% of any covered costs plus any co-payments up front.
Is there any way for me to get information on what original Medicare Part A and B is actually going to cover for me, or like what it's going to do ahead of me somehow, ahead of it starting to work? I have my number and everything. I just it doesn't look like when I click like select a plan and things like that, it's not giving me the option to like select a plan for Part A and B original Medicare. Is original Medicare its own plan type of deal, like a company that I call and talk to as a member for member services and things like that? Is that how this is going to work?
Yeah, that's us. You just called us.
Oh,
so
that's you guys.
For your,
y'all, I thought y'all were like the federal agency. Like I'm speaking Social Security, not necessarily like. Oh, well, I guess that does sound kind of dumb now that I said it out loud. Social Security is the ones who writes my checks, and or Treasury, and I do call them for stuff. Okay, yeah, that I feel dumb. So I call y'all, and you are Part A and B, and I go to y'all first, and only y'all about that.
Yes.
If I need transportation to my doctor's appointments, do I just call y'all?
Medicare doesn't cover transportation.
Is that what the state's supposed to be doing then? Because I've kind of been ruled by a judge that I'm not supposed to drive, so that wouldn't make much sense.
If you are eligible for Medicaid after all the appeal, then yes, usually state will pay for transportation.
And then they just put me back on a Medicaid plan or something to do that, or is it there's some other like part of Medicare's website that I could look at that?
I'm not sure. You would have to contact state to ask them how that works.
Okay, but there's no like specific service that it's billed as or like marketed as that I go to that website and then sign up for that thing and then I call that company. It doesn't. There's nothing like that. It's just I just talk to my state somehow.
Right.
Okay. There's no one else I can talk to or put in an appeal to expedite my access to Medicare due to my circumstances. I just have to somehow wait till May.
You would have to talk to Social Security Administration to appeal the start date.
Appeal the start date with Social Security Administration. Okay, so I just call their normal contact number and then appeal the start date for Medicare to push it forward.
Yes.
Okay. All right. I will do that. Thank you so much.
You're welcome. Do you have any other questions for me?
No, that's it.
All right. Well, thank you so much for calling Medicare. You have a good night.
Same.
Thank you.
Welcome to Medicare's automated customer survey. You will be asked 8 questions, and your feedback will help improve the service you receive in the future. Throughout the survey, if you need a question repeated, press the star key. Would you give the Medicare number to a friend? Please press 1 if the answer is yes, and 2 if the answer is no. Press 7 if you don't know. Please answer the following question using a scale of 1 to 5, where 1 is poor and 5 is excellent. You may use any number between 1 and 5 to answer the question. If you don't know, please press 7. How would you rate the person's knowledge of the Medicare system?
Repeat?
I'm sorry, we did not receive your response. Please answer the following question using a scale of 1 to 5, where 1 is poor and 5 is excellent. You may use any number between 1 and 5 to answer the question. If you don't know, please press 7. How would you rate the person's knowledge of the Medicare system? I'm sorry, we did not receive your response. Please answer the following question. Again, answer the following question using a scale of 1 to 5, where 1 is poor and 5 is excellent. If you don't know, please press 7. How would you rate the person's ability to give you a clear answer to your questions? How would you rate the person's ability to understand your question or concern? Please use a scale where 1 is poor and 5 is excellent. If you have used our website, Medicare.gov, please rate your most recent experience using the same scale of 1 is poor and 5 is excellent. Press 7 if you've not used the website. Using a scale of 1 to 5, where 1 is poor and 5 is excellent, how would you rate the time it took you to get through to a customer service representative who helped you? Thinking now about your general experience with using the automated telephone system, how would you rate the clearness of the instructions? Use a scale of 1 to 5, where 1 is poor and 5 is excellent. How would you rate your overall experience with Medicare customer service? Again, please use the scale where 1 is poor and 5 is excellent. Thank you very much for your time. Your opinions will help us provide the best service possible. Thank you for calling Medicare. Goodbye.